Good afternoon, everyone, or morning, depending on where you're joining us from. Welcome to the presentation on working together to improve health outcomes. Whoops, sorry, already technical difficulties. Okay, a couple of housekeeping items as we get started. Most of you, this is a Zoom meetings, which means you control your own mute button. So you should have come into the presentation on mute, and we're asking you to stay muted unless you want to speak. And
Patty, you're muted.
I wonder how I got muted. Sorry about that. So be prepared to share. It's very hard to have good interaction discussions virtually like this, but we're going to try our best. So we're actually going to utilize discussion questions and polling questions, and also ask you to put your information, your feedback, your expertise, your questions, and your ideas in the chat box as we go through. So to get your chat fingers up and ready to go, we're going to start with an icebreaker. So the question is, and enter your answer in chat if you wouldn't mind. Are you sweet or savory? And that can mean whatever you want it to mean. So go ahead and chat in your answer. And as you're doing that, I will continue on with the presentation. So the Regional Chronic Disease Collaborative is a group of partners that have come together to provide education and services in the approach to preventing and treating and managing chronic disease. The partners include Mountain Pacific, along with our regions of Alaska, Hawaii, Montana, and Wyoming departments of health, some of the primary care associations in those states as well, along with the American Heart Association. So we work together to bring quarterly education, hopefully in a valuable and relevant way. So my name is Patty Kasednar, and I work for Mountain Pacific Quality Health, and I will be your presenter today, along with my colleague, Deb Anderson. So today's agenda is going to be about talking about health equity and how you can expand care by connecting to community-based resources. We'll also talk about social determinants of health and ways to assess the needs for your patients and in your community. And then we are lucky enough to have two practice presenters who are going to share their experience and expertise on these topics. After that, we're going to do a breakout session. It's going to be a state-based breakout session where the Department of Health will share with you resources available in your state to address chronic disease, health equity, and social determinants of health. Then we'll all come back together in the main room and we'll finish up the presentation. We'll talk about calls to action and identify next steps. So clinical care, so let's get started. Clinical care, as we all know, is vital in the equation for health and wellness. However, according to studies, it's responsible for only about 20% of a person's health. So in order to really move the needle, we need to look at addressing these other categories as well. So you can help do this by leveraging community resources, helping to expand the care of your patients by partnering with complementary services offered by the community-based organizations in your area. So we'd like to get a little bit of a baseline. This is going to be our first polling question. So there's no right or wrong answer here, but we'd like to get just a sense of where you're at. So Maynette, if you would open the poll, we'd like you to answer, how well do you utilize, or do you feel you utilize community resources in your area? So we'll just take a minute there to let you all complete that poll. So 15% or so are doing very well. We'd love you to chat in what you're doing and how you're doing that. And it's about evenly split between could be better and pretty well. So it's good to see that people are doing that. Maynette, I think that's good. If you want to complete that poll, that's fine. It's still showing up on mine, but I'm going to keep going. So health equity, we want to talk about health equity as part of this conversation today. And there's a lot of different definitions out there about what health equity is. And so we're going to use this one provided by the CDC. And it states that health equity is when each person has the chance to reach his or her full health potential without facing obstacles from social position or other socially determined circumstances. So that's the definition. When we say the word health equity, that's what we're talking about today. So some factors that contribute to health disparities are social determinants of health, such as poverty or community conditions, behavioral factors, such as diet or engagement in physical activity, and medical services, such as access or availability, along with the quality of medical services available. And heart disease, cancer, diabetes, and stroke, these are the most common causes of illness, disability, and death affecting a growing number of Americans. And they tend to be more common, diagnosed later, and result in worse outcomes for individuals whose life conditions place them at risk for poor health. So by addressing social determinants of health, it can help improve health outcomes and health equity for your patients and community. Partnering with community-based or state-based resources can help you do this. So before you get all freaked out, I want to do a little bit of a reality check on this, because just the words health equity and social determinants of health are just incredibly overwhelming. In fact, when I was working on pulling together the information for this presentation, I just got so overwhelmed with all the information out there and how unempowered I felt to do anything about it. And then really, I had to really kind of just pull myself back and realize I don't have to solve the whole world's problems. That's not even within my power to do. So I thought this would be a really good point to give you some little recommendations and advice about this topic as we go through the rest of the presentation. So we don't have to solve all the world problems. You can start very small with something that you can control. And you can ask yourself, what can your organization handle right now? There might be better times or worse times to tackle an initiative. And also consider what's within your power to address. So, a lot of the social determinants of health or even the health equity categories are beyond anything we can do. But even small steps of improvement or change can lead to have a big impact. So think of that as we go through the rest of the presentation. So to continue on, I'm going to turn it over to my colleague, Deb Anderson.
Thank you, Patty. You did a great job explaining that key health factors include many things outside the four walls of our healthcare organization. So let's talk about the social determinants of health, also known as SDOH, and how collecting additional information about social needs will help our care teams to better address each patient's unique needs and their individual priorities. Talking to people about what specifically matters to them helps clinicians tailor care plans and address non-clinical or social issues as well. Next slide, please. Social determinants of health are conditions in the environments where people are born, live, work, play, worship, and age, and that affect health outcomes and risks. Specific examples are listed on the slide. I wanted to give you my example. My family uses an analogy with my 84-year-old Army nurse mother, and it's kind of starting to make sense now, I think. Her issue was that she didn't want us to say she was old. So instead, we now tell her she has lots of miles on her. So if our health is like a car and we're in the driver's seat, what do we do to engage? We make decisions about where and when to drive, what type of oil or what type of fuel to use, and how we maintain our vehicles. But we do put on the miles. Some miles may be harder than others and could determine the health of our vehicle. Here's an example. Driving exposes us to challenges like potholes in the road. What happens when a pothole causes a flat tire? Well, like a chronic condition, sometimes we just need to keep driving down the road, trying to fix what we can while the miles just keep adding up. But remember, when we start looking at correct maintenance for our vehicles, we can extend the life and hopefully get better service and better quality of use out of our vehicle. And we also can do things like having a nice garage to protect your vehicle from exposure to the elements. And I can kind of equate that to housing security if I think about it. So I realize that this is a bit silly, but hopefully you get the point that not everything, even with our cars, is within our control. Let's go to the next slide, Patty. Here are 2 well-researched and documented screening tools to consider using, but there are other templates and customized tools for various settings and platforms. The protocol for responding to and assessing patient assets, risks, and experiences is known as the PREPARE tool and consists of 16 national core measures as well as a set of 4 optional measures for community priorities. Core measures include education, housing, transportation, and the PREPARE emphasizes measures that are actionable. There are electronic health record templates for PREPARE in eClinicalWorks, Cerner, Epic, Athena Practice, NextGen, and more. Plus, these templates are freely available to the public as part of the PREPARE Implementation and Action Toolkit. The second is the CMS Accountable Health Communities Health-Related Social Needs Screening Tool. Aren't you glad we spelled all these out for you? The tool can help providers find out patients' needs in 5 core domains that community services can help with. These are housing instability, food insecurity, transportation problems, utility help needs, and interpersonal safety. Clinicians and their staff can easily use these short tools as part of their busy clinical workflows with people of all ages, backgrounds, and settings. So be sure and check with your community-based organizations on data they may assess in the work that they do that could be beneficial to your care team. Remember that data is good, but good data is better. Consider who is assessing the patients and what their relationships are. A person may be much more willing to talk with someone they trust rather than a stranger who they feel may judge them unfairly. The goal is to find what categories may be actionable for you and look for tools to help. You may find them in places you don't anticipate, including referral management systems, health information exchanges, lifestyle change programs, or accountable care organizations. Scooter at Riverstone Health will be sharing details on their best practices for assessing social needs and connecting to community resources shortly. All right, let's go to our first discussion question. Are you currently assessing for social determinant of health needs? Please chat in or unmute if you would like to share further information about your tools and what they're telling you.
And I would just add to that, Deb, if you are assessing for social determinants of health needs, are you doing that electronically or by paper? If you wouldn't mind chatting that in as well, that would be helpful, or even the name of the tool you're using. So we're getting some response in chat, some yeses and some nos, electronic. So yeah, great. Thanks so much.
Excellent. Thank you for sharing. So let's talk about where you could find information on state or community resources to assist the patients and their families. I'm always finding something new as we continue to support chronic disease prevention work across the region, and I'm interested in your other ideas, so please chat them in as well. All right, starting at the top, be sure you check your state 211 websites for state and local resource information. A lot of these sites have been up and running for quite some time, and hopefully you're able to find good information for your areas. Additional databases or sites like the Aging and Disability Resource Centers, called ADRCs, and other community support sites may provide additional details and local contacts. Several healthcare facilities and communities have worked collaboratively to create printed or online resource guides. Resource or support groups can be found on Facebook or other social media sites and are sometimes linked from public health, a healthcare facility, or even local media websites. Newer platforms are rapidly emerging to connect and track referrals to community-based resources. thanks in part to the public health emergency and the increase in the need for assistance. AARP came out with their Community Connections website in response to the coronavirus pandemic called Connect to Affect, which appears to be hosted by Aunt Bertha. The Aunt Bertha site actually rebranded just recently to findhelp.org. What I like about both of those sites are the additional resource categories, including social activities, caregiver resources, and wellness and health. We do have new initiatives in both Wyoming and Montana with Unite Us. The funding for that was provided from CMS through Sync Health, which is the Nebraska and Iowa Health Information Exchange. Let's see what other ideas that you've shared. Patty or Kristen?
Kristen, anything in the chat on other sources for information or community-based resources?
It looks like Avery mentioned recently incorporating the Prepare tool into Unite Wyoming for all community organizations. And Melissa had mentioned an integration of SDOH screening into their database for our DPP and DSME programs, so our coaches and DCESs can screen their patients. A lot of folks saying that they're screening in either a formal or very informal way. So it seems like there's a consensus on the line that this is an important topic.
Excellent. Thank you. Let's go ahead and go to the next slide because we thought of a few other organizations for you possibly to connect with. And we recommend that you collaborate on ways to reinforce healthy behaviors with these partners as well. Some communities have put healthy behavior information or local resources in church newsletters and posted them at their senior centers. So get familiar with what is available in your community at your food banks, community kitchens, and be prepared to share contact names or schedules as those are relevant to your patients. So remember, the goal here is to learn and share, increase the exposure to programs that provide assistance. Now more than ever, we know that there are needs being unmet. All right, let's go to discussion question number 2. Please chat in what community organizations you refer to regularly. If you are willing to unmute, you can also let us know how you found and built relationships with those resources.
Okay, we'll let them chat in as we continue on, Deb, okay?
Not a problem. Okay, so our next slide is talking about our quality improvement efforts. So I'd really like you to think about how you leverage community resources to help address social needs and improve health outcomes. And what can your clinics or your organizations do to help improve health equity? Also, feel free to chat in those suggestions. In Wyoming, we're just starting to leverage data from our electronic health records and our health information exchange to work with vulnerable populations. This can be difficult. And again, we want to encourage you to start small since it's less burdensome. Be sure you consider if your QI project may impact more than one group of patients positively or negatively. And if you have any examples of what you may have learned after doing a quality improvement project, when you looked back at it with a health equity lens, please feel free to share that as well. Let's go to the next slide, Patty. So when working on your quality improvement projects, think of ways to focus on health equity. Here's some examples, and you're welcome to chat in your examples as well. Focus on improving care for a population that has historically experienced disparities in care or is an underserved population. The examples I could think of would be migrant farm workers, homeless populations, or Medicaid patients. And then when you have your data, make sure that you're analyzing and comparing for gaps in care when it comes to different race or ethnicity or age. Some examples are the A1C rates for English-speaking patients versus non-English-speaking patients, or hypertension blood pressure control for elderly who are living alone versus those who are not socially isolated. And then also breast cancer screening rates based on ethnicity. Remember to leverage your community groups that can help support the social needs of your patients to reduce health equity gaps as well. Okay, if there's no further questions or information, anything in the chat, I would like to introduce Maureen Hurley. I'm honored to introduce Maureen from Campbell County Health as our first practice presenter today. She will share how she identifies and connects with community resources. Hot off the presses, Maureen will be retiring this fall after decades of patient care in home health, hospice, and as the coordinator for chronic care management for over 2 years. I'm sure all of her 5 grandchildren will be thrilled, as will her sons, who may not be planning to take those kids bow hunting with them this fall. Grandma gets to babysit. Take it away, Maureen.
Thanks. They've already booked me. I'm pretty well taken care of this fall. So anyway, thank you for inviting me to this. This is definitely one of my passions. In my nursing career, I was blessed to work in community health through home health and hospice for many years, and then transitioned eventually into chronic care management, working more with the clinic-based providers. But funny thing is, it's like if you haven't watched a soap opera for years and years, and then turn the TV on, and it's like, wow, it's the same people. I find that often that people I've taken care of in home health, not so much hospice, but in home health have, they're still with significant needs, and I get to take care of them now a little bit more telephonically than in home health. So, and one of the benefits I have is I've been in this community for a long time, and I've seen a lot of the services and programs we have, and we are extremely fortunate, I think, in all of Wyoming. And I know in Campbell County with the resources we have. So I'm going to talk about some of the resources, and keep in mind that many of these resources that I'll speak of actually work very well together. So if I were to, maybe call, for example, Wyoming Independent Living, and talk to Tina on the Vision program. She's awesome at having resources that maybe I wasn't aware of or I hadn't thought of, and she connects me that way. So having a community of service members that you can rely on and work with is a big benefit. In our community, we have a wonderful recreation center. And a bonus for that is that once you turn 62, there is no charge. So anyone 62 or over can use these facilities for free. The senior center, which I believe is for 60 and above, and which I have to say, all of these people are now my peers too. And so I will be tapping into some of these benefits myself. But the senior center works with their members on with transportation and stuff to get them to the recreation center. We have Lazy River that is part of the aquatic center, and that is very popular with our aged population. And so the senior center provides transportation several days a week to get people that are interested in either water walking or any of the other many activities there. It's quite, it's very well utilized. Definitely our senior center, which provides Meals on Wheels, transportation for our senior and disabled community members. We have phenomenal parks and walking paths, which just, when I go and visit other areas, it really reminds me of how blessed we are in Wyoming, and notably Campbell County, to have the facilities and the parks and such that we do. So I actually have a map of the parks, and I will, when for my patients that I'm working with, if it's appropriate, I'll send them a map and highlight some of the parks that might be, they may be able to benefit from. Housing assistance, I wanted to talk about. We do, of course, utilize our senior housing, which sometimes is, there's rent assistance with that. There's also utility assistance that we can help people get in touch with, and that's through the city utility department that they go for help there. We also have community homeless shelter that I definitely have referred to. I've actually had home health, and actually we had a hospice patient in a homeless shelter at one time. Nutrition is definitely part of the assessment that I continue. I do initially on my patients, and that pretty much continue reassessing that. And we have available the Meals on Wheels, low cost if they qualify for Medicare for one of the home or the community waivers. Meals on Wheels can be part of that program, and that helps especially with our diabetic population or any other chronic diseases if they're having an opportunity to eat well-balanced meals. Versus one gal I started working with about 4 months ago, and she has many chronic illnesses, and she can't walk that well, but so she would drive. She can't drive that well either, but she did drive. And she would go to Kentucky Fried Chicken pretty much 6 or 7 days a week. So I, just hooking her up with Meals on Wheels was huge. We have food. Yes.
This is Patty. I was wondering, it sounds like you have a lot of community-based organizations that you're able to partner with. Are you able to share a little bit about your referral system, like how you actually do the referral system?
You bet. And just to clarify on the referral system, I'm sorry, for my program or referring people to these programs?
Referring people to these programs.
Okay, that's what I thought. I just wanted to. So most of the time it's just a phone call. Obviously I have to talk to the client that I'm working with and get their, have them buy into it. It's their care plan that I'm just helping them develop. But when I give them the list of options that they have, then I usually will make the phone call for my client and have either the organization get in touch with them. Occasionally, I will meet them at the organization if someone is not really comfortable going out and seeking services. I will join them on that. Getting in touch with the Lions Club for glasses or the Salvation Army for needs. None of these organizations are difficult to get in touch with or communicate with, and it most often is as simple as a phone call.
Great.
So I think actually the Lions Club, they have a questionnaire, and it has like 5 questions on it. And I think that's the most extensive form I've had to complete. So
good. Well, Maureen has a lot of information to share, and it sounds like you're really successful in Campbell County utilizing your community-based resources. If you have any questions for Maureen, so Maureen, if you want to monitor the chat, go ahead and chat any questions you have for Maureen. Not to cut you off, but I want to make sure we get to our next presenter as well. So thank you so much, Maureen, for sharing that information. And then I'm going to introduce our next presenter, Scooter Gates from, she's a care manager and team coordinator from Riverstone Health, which is an FQHC here in Montana. And she's going to talk a bit about assessing for social determinants of health and using that information to connect to the community resources. So Scooter, go ahead and take it away.
Hi. Well, thank you everybody for joining in, and like to share just a little bit about what we do here at Riverstone. So when I say what we do, it's the care management team. We have 7 care managers on our team. Our units are broken down into pods. So we have 4 clinic pods. We have a specific behavioral health care manager. We have an RN care manager that's our transitions care manager. She kind of works with hospital discharges, nursing home discharges, referrals to home care. And then we also have 2 offsites in the community-based healthcare for the homeless programs. So pretty much really any point of entrance for a patient to come into Riverstone Health, we have the ability to provide some service. So what we do, we adapted from the Prepare, which is the national program that Deb had mentioned earlier. We adapted to make our own form to screen for social determinants of health. And it's kind of color coded, as you can see here. And we did that for the reason is to bring to the doctor's attention. They want to look at the beige things, which talks about safety, talks about how many people do you talk to a week that you care about or you feel close to, might show some signs for loneliness and some isolation, especially in our seniors. So the beige section is really for the doctors to take a quick peek at. And then the other sections are for the care managers to review. And we ask questions about transportation, housing, medicine and healthcare, insurance, just the utilities, just the general basic needs. So a patient is given this form once a year on an annual basis, calendar year annual basis, and they fill it out and then they take it with them back to their appointment. Then the care managers are notified if they have checked any areas of need, such as food or utilities, they don't have health insurance. And in an ideal world, we try to see patients while they're in the clinic and to kind of go over those needs and explain to them, what our role here as a care manager is just to help connect you to community resources, make sure you have what you need to have to be successful in life, and help connect them with those services. We have a program that we use internally. It's called OneNote, and it's actually part of the Microsoft Outlook program. And so through OneNote, we have developed all of our resource information, and we have it in a printout form that we can give to patients. And it really kind of depends on the patient. Some of them, we can give them the form that has all the contact information about this is the agency, this is the phone number, their address. This is what you need to ask them when you're going to call. As we know, sometimes if you don't phrase the question correctly, they get tossed around to a whole bunch of different people. So we want to try to be able to give them the words they need to know what to ask for when they call that different agency. And then and some of them will take that information and say, no problem, I'll do this on my own. We have others who kind of get that glazed look when you give them the paperwork and they're like, I can't do this. And so we can help while they're still in the clinic. We can help call and initiate that interaction, just to say, hey, I'm calling for so-and-so. They need assistance picking up a food box. I'm going to let you talk to them now so that you can kind of coordinate what they need to bring down to you as far as ID or anything, and how can they get that done. And so we can just kind of help bridge that referral with the patients. In a non-ideal world, if for some reason we weren't able to see the patients in the clinic, we follow up and call them after they've left the clinic and just say, hey, I noticed you filled out this form and you identified an area of need such as transportation. What can I do to help connect you to some community resources? And just kind of talk about what their needs are and do that connection with them. We do document all of this in our electronic medical record. And so we have all the data that the care managers input. And then also we would write a care plan saying that we connected them to whatever different resources. Kind of what we're doing now with our data, we've been doing this for probably 4 years. And so we have a lot of good data on what resources are identified as needs every month. Each month at our monthly care management meeting, we talk about the top 3 areas, which over the last few months have consistently been medicine and healthcare, food and utilities. And so we talk about that amongst our team to say, okay, anything we're missing, any place else we should look. And the advantage of that is with the summer, we have a lot of great farmers markets, a lot of fresh produce available. And so we're wanting to make sure we get that information out to families over the summer. One of our local markets, they offer a double SNAP benefit. So for example, if you pay $20 in SNAP benefits, you actually can get $40 worth of produce, which is fabulous for our families to be able to get that extra produce, fresh produce during the summer. So we just want to make sure we have all that information and that's current. I will say one thing about the OneNote program, which is our resource. It's a little monster to keep track of. And so keeping it updated and keeping it current is a project, I will admit to that. One nice thing about COVID, we had some downtime, so we're able to go through and update all of our different resources and make sure we had the right addresses and contact numbers and fax numbers and things like that, applications, if there's an application for them to fill out. So it is a very handy resource, but it is time consuming to maintain. And then what we do as far as referrals, if the patient can self-refer, that's awesome. Gives them some independence and let them handle it on their own. If they can't, we get their permission and then we can help initiate those calls, initiate doing some applications, especially for housing. Housing applications can be kind of overwhelming. They can be, 5 to 10 pages long and ask a lot of questions that you're not really sure how to answer. So we can also help with that as well.
Great. Great. So we have a lot on our agenda, so I'm going to have to move along, Scooter. But thank you so much. I love the fact that you're collecting the data in the EHR and actually reviewing it and assessing it and adapting your program as you need to. So perfect PDSA cycle you have going there. So nice job. If you have questions for Scooter, go ahead and just put them in the chat, and she'll monitor the chat. And we'll just continue on with the presentation here. Thank you so much to Maureen and to Scooter for volunteering to share your expertise. So thank you so much. So we'll continue on. So our the next item on our agenda is going to be our breakout rooms. So what we're going to do is we're going to take 15 minutes and break out into state-based breakout rooms. In a second, it's going to pop up on your screen. You choose the appropriate breakout room for you. And a State Department of Health staff member will be facilitating the discussion and sharing resources with you. When that 15 minutes is up, you'll automatically be brought to the full group and we'll continue the discussion. So Maynette, if you want to go ahead and pop up those breakout rooms, that would be great. So if you scroll all the way down the list, you will see the rooms and go ahead and join. Whoops. So Maynette, how many people are still in this main room? Quite a few.
Quite a few.
Yeah, so if you guys go down, scroll down till you see the name of the states and click on join to join those rooms. So Hope, if you want to join Montana, that probably makes sense. And if you, Margaret, Montana, that makes sense. Barry, Hawaii, possibly.
Does make sense, but I'm not finding the room.
There's a scroll bar. Do you see the pop-up block that says breakout rooms in progress?
No.
Is there a box in the middle of your screen?
No.
I do not see that.
Okay.
So you may have to move them
No,
manually.
I don't see a box either.
Okay, so if you take, would you move Hope Kratz to Montana, Maynette, and
Okay.
Margaret to Montana?
Yes,
If
thanks.
you want to chat in the, I don't know, Barry Majors could be Montana. And the rest of you who haven't joined a room, we can, if you put it in chat, we can move you. So Louise, I can move you to Montana. Ryan, Hawaii. Anyone else who hasn't joined?
Still about 11 or 10 people, I guess.
Sherilyn wants to go to Hawaii. Anyone else? Just put in chat where you want to go. Nanny said you're in Hawaii. Do you want to go to Hawaii, Nanny? I'm not saying that right.
No. I want to go.
To Montana?
Yeah.
All right. Rihanna, there's not a pop box. So Rihanna, what state would you like to join? Montana, Wyoming, Alaska, or Hawaii? Wyoming, okay, I'll move you into Wyoming. Miriam, Margaret, do you want to go to, I'm going to move you to Montana.
Yep, Montana, please.
Okay. Diana, Crystal, Trissa, do you want to move somewhere? Put it in chat and I'll move you to the room. All right, I'm going to jump in. It doesn't look like anyone's in Alaska. I'm going to jump in there for a minute, Maynette. You want to monitor
All right.
left in here?
Sure. Hi, Crystal, Diana, Trissa, do you know what room you want to go to? There's an S054872. What room would you like to go to?
I'm not sure why Maynette, but no one's in Alaska.
There was one person earlier, but they left it, I guess, because they're the only one there.
Ashley was supposed to present. I wonder if she didn't. Let me try to go to participants. Oh, I guess I can't anymore.
Who were you trying to look for?
Ashley, I'm going to quick look. I don't see her as having joined, so I'm going to join the Montana room.
All right.
Hey, Minette, are you still in here?
Yes, in the main room, yes.
Yeah, so am I sharing my screen again? Is it showing the one PowerPoint that says breakout sessions?
I am seeing that.
Okay, perfect.
So it looks like there's about 2 minutes, 45 seconds left.
Right, right. Any minute now, right?
Yes.
Yay.
Go ahead and close the rooms.
Yeah. Oh, we got another minute.
Oh, was that the, okay.
Getting close on time. Oh, everybody's popping back. Yay. Mindy, I like your view, your background. It's quite nice.
Thanks.
I used to live in Livingston, Montana, and I moved back to Wisconsin for family reasons. And the mountains, it's killing me. I miss them so bad.
I wish it was my true view, but
Right. Well, that's true. All right. It looks like everybody's jumping back. So I'm going to continue on. I don't know how to confirm everyone's back, but I'm going to trust maybe the technology and move forward with that. So hopefully everybody got information from their breakout rooms from their states that can help them connect with resources that can help address chronic disease prevention, management, and treatment. And so again, when you're thinking about let me get to the right screen here. So when you're thinking about health equity and social determinants of health, and we got good information today, remember, you don't have to solve the whole problem right now. And the most important thing really is don't let the enormity of the topic stop you from taking action. Even small action can help. And so, speaking of action, here are calls to action that we recommend. Here are just some things that we recommend that you can do to just start on the journey or continue on your journey. One is implement a social determinants of health assessment tool. Help identify the needs of your patient population. Another one is reach out to just even one community service partner and discuss shared goals and a possible partnership. Another one is connect with your state. We didn't talk about this very much, but there's bidirectional referral tools in at least 3, I think maybe all 4 of our states that may be available to help you coordinate and control and manage these referrals to community-based resource systems. And then my favorite and the one nearest and dearest to my heart, because I work with a lot of you on quality improvement projects, and that is try to include a health equity component in your next quality improvement project. So we talked about a lot of things today, and again, it was hard to choose what to focus on in an hour. And we want to continue this conversation with you in the form of an affinity group. So an affinity group is taking this topic and actually doing something actionable with it. So we came up with these 3 ideas for a possible affinity group. So implementing a social determinants of health screening tool, establishing a community partner referral system, or creating a quality program or project that includes a health equity focus. So what we'd like to do, if you want to turn on the poll now, Maynette, we'd like you to choose one of these topics that you would be most interested in participating in an affinity group. So go ahead and please share your information. And if you have an idea for an affinity group, and again, affinity group is just a group of clinics that would work together on a topic. If you have an idea for one, go ahead and put it in chat, because these were the ones that we came up with. But believe it or not, we don't know everything, even though I act like I do, but we don't. So go ahead, any of your feedback on that would be welcome for sure. And then we'll work on pulling together an affinity group once we get this polling done. I'm going to give it just a 10 more seconds, or actually, if you need to end it, that's okay. That's okay, Maynette. And I'll go to the next slide. So because if you are interested in doing an affinity, group, go ahead. We didn't do another poll, but if you would like us to contact you about participating in an affinity group, in the chat box, just enter affinity group and we will reach out to you and contact you and bring you in. So if you're interested, put affinity group in the chat. And then for the presentation today, we accessed a lot of good resources, and there's still a ton more out there. So here's just a few of them that we used, and the links to the social determinants of health screening tools are on here, along with some American Heart Association resources and others. And then we just have one more polling question for you. The Regional Chronic Disease LAN will do another event next quarter, and we want to make sure that we're covering something that's relevant to you. So Maynette, if you can kick off the polling, help us identify what the next education topic should be. And again, if you don't see something that's interesting to you here, or if you have another idea, go ahead and chat that in, and we can take that under consideration as well. And your feedback really helps us identify what we'll do next. So please take a minute and do this. It really does help us keep this collaborative going and hopefully bringing you valuable information, at least on a quarterly basis here. So I'm not monitoring the chatting, but if you guys have any other ideas, go ahead and chat it in. All right, I'm going to just wait 2 more seconds. Let's give people a little bit more time to vote, or how about 5 more seconds? And you can choose more than one. So choose however many you find interesting, and then we'll total it up. All right, I'm going to go on to the next slide here because we're running out of time and I want to honor our deadline here. Oh, it's the thank you. I want to thank our practice presenters for sure for showing up and sharing their valuable feedback and experience. Deb Anderson, thank you so much. And all of you for your participation and your attention. And we will see you next quarter. Thank you so much.
Patty, the evaluation link is in the chat box. So let's remember to request that everybody fill out an evaluation.
Yep, thank you so much. And it might pop up too automatically when you close out of the meeting. Thanks, everyone. Have a great rest of your day.